morning everyone, welcome back to another vlog and welcome back to another video. Today vlog is going to be very beneficial for you guys. So if you are new on my YouTube channel, don't forget to like, subscribe and share. So let's start the video. So today our topic is renal artery disease. So I share with you guys a scenario about renal artery disease. So let's start the video. So a 56-year-old man with a history of hypertension present to his primary care physician for blood pressure management. He has tried bisonophils, hydrochlorothiazide, and losartan and had a minimal effect. He has a strong family history of cardiovascular disease. Physical examination is notable for a bruit in the right flank. Routine blood work shows an elevated creatinine. Prepartum are made for a Doppler ultrasound of the renal arteries. This is the scenario, and let me know in the comments that according to you guys, what is the exact diagnosis of that scenario. So let's start with its clinical definition, and its clinical definition is that narrowing of one or both renal arteries. This is often causes renal hypertension, and it has three grade. Grade 1, which is RAS, which is renal artery stenosis with no symptoms. Grade 2, RAS, which is renal artery disease with resistance hypertension, and grade 3, which is renal artery stenosis, and it has with resistant hypertension, abnormal renal function, or volume overload. Now let's talk about its demographics. Arteriosclerotic disease, and patients who are above 50 years of age have a chances to have that disease. And fibromuscular dysplasia, it is mostly seen in younger women. So now let's talk about the risk factor of renal artery disease and arteriosclerosis and its risk factors. For example, smoking, fatty acids, fibromuscular dysplasia, kidney transplant disease, high calcium or phosphorus level, high low density lipoprotein, cholesterol level. So now let's talk about its etiology. Narrowing of artery lumen due to arteriosclerosis, fibromuscular dysplasia. Number 2 is reduced perfusion lead to activation of renin-angiotensin system, increased renin, hypertension, hypercalcemia, heart failure, pulmonary edema, carotid artery disease, lower extremity artery disease, and coronary heart diseases. These are the etiology of renal artery disease. So now let's talk about the symptom of renal artery disease. So now let's talk about its symptoms. A wheezing sound that your doctor heard through a stethoscope. High level of protein in your urine, elevated protein level in the urine, or other signs of a problem. These all are the symptoms of renal artery disease. So now let's talk about the diagnosis criteria of renal artery disease. The diagnosis criteria of renal artery disease is that, first of all, we perform ultrasound, we perform MR angiography in patients with renal insufficiency, invasive catheter angiography, and we perform CT angiography. So now let's talk about the lab test. Serum creatinine. We perform serum creatinine test to assess renal function. Number 2 test is urine protein to assess renal function, which range is 3.5 gram in 24 hours. And if we saw their histology, so we saw fibromuscular dysplasia and medial fibropalsia. So now let's talk about the differential criteria of renal artery diseases, that essential hypertension, primary hyperaldosteronism, and obstructive sleep apnea. These are the differential diagnoses of renal artery disease. So now let's talk about the treatment of renal artery disease. The treatment of renal artery disease is that we give ARBs, we give ACE inhibitors, we give persistence. Okay, we give ACE inhibitors, we give ARTs to a patient who are suffering from renal artery disease. In patients, its indication is that it persists hypertension in patients with ROS. So this is the treatment of renal artery disease. Moreover, we gave calcium channel blockers, beta blockers to a patient who are suffering from renal artery disease. So now let's talk about their operative criteria. So in operation, we perform renal vascularization. So now let's talk about its complication. And its complication is that renal dysfunction can process and lead to end stage of renal disease, dialysis and kidney transplant. This is the complications of renal vascularization. Hope so this video proves very beneficial for you guys. So if this video proves very beneficial for you guys, don't forget to like, subscribe and share.